272 Albertans died from an overdose of fentanyl. That's an increase of 267 Albertan deaths since 2011, or nearly 46 times as many deaths. Just today we saw Alert announce a massive seizure of 4 kilograms of W18, which is about 100 times stronger than fentanyl. That would have produced hundreds of millions of pills. And earlier this month, British Columbia declared a public health emergency surrounding the increased number of overdose deaths from illicit drugs. It was unfortunate that our provincial government did not do the same. The province approved the dispensing of naloxone kits, which was a step in the right direction. However, these kits are a band-aid solution to a big wound, a reactive response where we need proactive measures. More needs to be done to address this staggering escalation in fentanyl abuse and overdoses, and it needs to be done now. That is why I'm extremely proud to introduce Bill 205, a bill that will provide us with the direct opportunity to save the lives of Albertans by keeping these drugs off the streets. Bill 205 will do a number of things to address the crisis. Namely, it will regulate the possession of pill tablet presses. That means criminals will not be able to legally purchase a pill press for a few $1,000s and mass compound or distribute the drugs. It will also establish clear penalties that will have a serious financial impact on those who unlawfully own, operate, and possess pill or tablet presses. Fines for criminals to have them in their possession can reach $50,000 for first offense and escalate up to $375,000 for a third offense, or offender can face imprisonment for up to 6 months. The penalties may sound steep, but it's important to remember that criminals manufacturing this deadly drug are becoming multi-millionaires and profiting off the lives of innocent Albertans. Based on RCMP information that we have received, 1 kilogram of pure fentanyl equates to anywhere between $20 to $40 million based upon a variance of street value. Additionally, the penalty fees will go to help victims of crime. And that, in my opinion, is one of the absolute most important things. And it will create a regulatory process that will outline protocols for seizure and removal of pill or tablet presses by law enforcement. Fentanyl and W18 are serious problems in not only Alberta, but around the world. And while these measures outlined in Bill 205 won't solve that problem, it will do a heck of a lot to address it. It will give police a critical tool to deal with the illegal production of these deadly pills. And it will also make it more difficult for criminals to manufacture these drugs. But we still need to address the root cause of drug abuse and ensure addiction support is available to Albertans who need it and when they need it. That is why it is critical to support organizations such as the 1835 Recovery House in Calgary that develop long-term care beds that will address the root cause of the addiction itself. I'm proud to see Alberta lead the way in addressing this issue. Alberta can lead the nation by restricting pill presses in our fight against fentanyl and other illicit drugs. I will continue to pressure our federal government to extend the same federal legislation across Canada as well. I look forward to bringing this private member's bill forward in the House and for debate that will obviously follow. We are in a unique position to have a direct and positive impact on the lives of Albertans by reducing the amount of fentanyl pills in our community. Thank you very much for your time, and I certainly look forward and are happy to answer any questions at this time.
You're a former police officer,
Yes.
obviously. I mean, what have you heard from former colleagues that you may have had about what kind of effect or impact a measure like this would have in terms of, limiting the purchase of a pill press and that sort of thing?
Well, thank you. We of course consulted with stakeholders, including the RCMP, as well as members of the Calgary Police Service, and this is something that they found when they were making fentanyl and W18 busts. The offenders always seem to have that pill press. So when we consulted with stakeholders, including members of the medical community, pharmaceutical community, as well as I said, the police, nobody could give an absolute valid reason why somebody would own a pill press other than a pharmaceutical dispensary, which is why we put it under the Pharmaceutical Act. Yeah.
What's your sense of the sort of the government's, I guess, response to this proposition that you're putting forward?
Well, yeah, I mean, I consulted with them as well. I mean, you know, if we're going to have anything that's successful and we're going to actually make an actual impact in saving lives, you want to have a buy-in from everybody. So, absolutely, I consulted with Minister Hoffman, and certainly I received some positive responses from her, and obviously we'll see in debate how it goes. But so far, I've received nothing but positive feedback.
When are you expecting it up for debate first time? Will it be Monday or
I just
later
introduced
on?
it. It's obviously up to the government. Yeah.
How would you regulate it? Would somebody have to have a license in order to obtain one of these devices?
Yes.
Okay.
Yeah.
And it would be issued by the Alberta government?
Yeah, and so we again, talking with the pharmacies and the pharmaceutical, obviously it's going to fall under their act, right? And it would be, I think most of you remember the Body Armor Control Act, where it had to be licensed, so this would fall along similar lines. Yeah.
Is any other province doing this, or
No.
are you the first?
No, we're the first, and we're very proud of that. Yeah.
And where did you get the idea for this? Were you hearing from this from pharmacists in your own experiences as a police officer? Or?
Well, you know, quite frankly, I mean, obviously, I've been out of the game here for about a year and a half, right? But you know, for us, or for me, when I was on the street, OxyContin was the big drug at the time. But obviously, staying in contact with stakeholders, police friends, stuff like that. You know, telling me about this deadly drug. Obviously, it's hit the media. And of course, you know, like any good investigator, I did my research, right? And I discovered that, you know, there was one common thread when any drug bust was occurring, and the pill press was it. So if we can, again, if we can provide an impact in the distribution and manufacture of this drug, then you know, we're doing a good thing. We're saving lives.
I don't know a lot about W18, but it's also made in pill form?
Yes,
it is. Okay.
Yeah.
What do you make of the government? So there's been some criticism of the current government's reaction, or I guess lack of proactive response when it does come to issues like the fentanyl crisis, or what we've seen today with W18. You know, people not having known about the seizure or the lag time in terms of the lab test results. What do you make of the government's response on these kinds of issues? What more needs to be done?
Well, you know, I touched on that in my speech. You know, it's the long-term care beds, in my humble opinion. You know, when we have these recovery beds, I want you to think about this. As a recovery bed, the person still leaves as an addict. So the cycle of recidivism is still going to continue. We have to get to that root cause, and that root cause is actually dealing with the addiction itself. If we can deal with the addiction, then we can at least put a slowdown on the recidivism.
Great. Any other questions? Okay, thanks for
Thank you very much for your time.